More than 400 people have died in Jamaica from complications due to COVID-19 since the start of the pandemic in 2020. Chief Medical Officer Dr. Jacqueline Bissessy-McKenzie says the largest case fatality rates occurs in those persons over 60 years. The CMO gave a situation update during the latest COVID-19 press brief on Sunday.
The numbers don't lie, and the numbers are bleak. Up until Saturday, February 27, there have been 422 deaths from COVID-19 and over 23,000 cases in total. The island's Chief Medical Officer, Dr. Jacqueline Bissessy-McKenzie, says there is cause for concern. Specifically, she pointed to the island's virus reproductive rate and the increased virus positivity rates.
As you can see, that our case numbers would have started going up from early January and have continued to go up, and we are still increasing. We have not plateaued as yet. So even more important why it is that we need to have some restrictions in order to prevent the case numbers from going up further. This slide speaks about the reproductive rate. And here you can see that while it is that we are not at the highest number in terms of reproductive rate, we're actually at about 1.3 compared to in the past where we have had numbers at 2 over 2. We would see that because of the number of positive cases, certainly if you have 400 positive cases and you have a reproductive rate of 1.3, it means that we expect over 400 persons, almost 600 or so, to be infected by this set of 400 persons. So because of the larger number, it is even more significant where the numbers are concerned, even though the reproductive rate is at 1.3.
Another worrying trend is that of positivity increases in all parishes. However, the CMO singled out the parishes with the highest case counts.
Here we quickly look at what's happening across the parishes, and we can see that our problem parishes still remain St. Catherine, Kingston and St. Andrew, St. James, and we've had increasing cases in Clarendon, in Manchester, and in St. Anne. So the precautions, persons in those parishes really need to pay particular attention to precautions.
There is also the issue of bed space. Increased cases are driving up hospital admissions and straining the capacity at these facilities.
This graph shows us that the number of admissions per week has been increasing. So it is not just a matter of that we have patients that are long stayers on the beds, that are occupying the beds, that are causing us to almost be at 100% positivity rate. The fact is that since December, we have seen where we had an average daily admission of about 20 to 25. Now we have a daily admission rate for COVID, suspected or confirmed cases, of between 45 to 50. So the admissions per day are in fact increasing.
These statistics bear out the stark reality of an island under siege from a silent, faceless enemy. The pandemic continues to run rampant through community transmission, even as the government tries to get a handle on the worsening scenario. For the news on PBCJ, I'm Gabrielle Thompson.